Today is Tuesday, April 2nd, 2024. This article is from Johns Hopkins Medical Center. Johns Hopkins Medicine, right? This is about encephalitis. I was suspicious of something like this, and I always wanted to know what the encephalitis. So that's where here I am now. I'm going to read these to practice English. Yes, I am not a Korean. I'm not American, so I need to constantly practice English by reading an English material on a daily basis. So here we go. Encephalitis, brain, nerves, and spine. Encephalitis is a serious condition affecting the brain that requires prompt treatment to lower the risk of lasting complications or death. What you need to know. Symptoms of encephalitis vary depending on the affected area of the brain, but often include headache, sensitivity to light, stiff neck, mental confusion, and seizures. It's important to see a doctor promptly if you are experiencing symptoms which may not seem troubling at the time. Timely diagnosis and treatment are the keys to a successful recovery from encephalitis. There are many types of encephalitis, and the causes vary from a viral infection to an abnormal response of the immune system. And the causes vary from viral infection to an abnormal response of the immune system. What is encephalitis? Encephalitis is inflammation of the active tissues of the brain caused by an infection or an autoimmune response. The inflammation causes the brain to swell, which can lead to headache, stiff neck, sensitivity to light, mental confusion, and seizures. Encephalitis strikes 10 to 15 people per 100,000 each year, with more than 250,000 patients diagnosed in the last decade alone in the U.S. The condition can affect anyone, but more often occurs in younger people. Encephalitis causes and types. Encephalitis can be caused by infections or autoimmune conditions where the body's own immune responses attack the brain. Even with extensive testing, the specific cause of encephalitis remains unknown in about 30% to 40% of cases. Someone says 30 to 40%, but here about 30% to 40%. A little bit peculiar expressions, right? That's quite peculiar. Peculiar. Right. Peculiar. Yeah, I'm cooking. I'm boiling eggs, so I need to just bear with me. I'm done. So. Good. Everything's good. So, encephalitis causes and types. Cases of encephalitis are likely to continue to rise as more and more autoimmune causes are recognized. Emerging infections such as Zika, chikungunya, and Powassan viruses can also contribute to this trend. Infectious encephalitis. Infectious encephalitis is typically caused by a viral infection. Vaccines for measles, mumps, rubella, and chickenpox have reduced the rate of encephalitis from these diseases, but other viruses can cause encephalitis. The most common causes of viral encephalitis are herpes simplex virus types 1 and 2, varicella zoster virus, and enteroviruses, which cause gastrointestinal illness. Encephalitis can also result from certain viruses carried by mosquitoes, ticks, and other insects or animals such as West Nile virus, Japanese encephalitis virus, La Crosse virus, St. Louis virus, equine viruses, Powassan virus, Zika, chikungunya, other infectious microorganisms such as bacteria, fungi, and parasites can also cause encephalitis though rarely. Autoimmune encephalitis. Autoimmune encephalitis occurs when a person's own antibodies or immune cells attack the brain. Other immune cells, right? Antibodies. Antibodies may target specific proteins or receptors in the brain, which determine the type of autoimmune encephalitis. In anti-NMDA receptor encephalitis, the immune system targets the NMDA receptors in the brain. In VGKC complex antibody encephalitis, the immune system targets the VGKC brain protein complex that includes subtypes LGI1 and CASPR2. GABA A, GABA B. May also be targeted. While the causes of autoimmune encephalitis are not well understood, it can sometimes result from a tumor, benign or cancerous. Some types of autoimmune encephalitis, such as acute disseminated encephalomyelitis, ADEM, are typically targeted by an infection, post-infectious encephalitis. Encephalitis symptoms. Acute encephalitis shows up with an onset of symptoms that get worse over the course of days to weeks. Good. Very hot, burning, because I just took the eggs from the boiling pan. Infectious encephalitis often starts with flu-like symptoms or headache and evolves to altered mental status and problems with thinking, remembering, and reasoning. Autoimmune encephalitis typically progresses over the course of weeks. Symptoms of encephalitis vary according to the area of the brain affected, and in autoimmune encephalitis, depending on the associated antibody. Physical symptoms: fever, seizures, headache, movement disorders, sensitivity to light, sensitivity to sound, neck stiffness, loss of consciousness. In severe cases, encephalitis symptoms may include weakness or partial paralysis in the arms and legs, double vision, impairment of speech or hearing, coma. Cognitive symptoms: excessive sleepiness, confusion and disorientation, irritability, anxiety, psychosis, hallucinations, memory loss, other behavioral changes, cognitive impairment. Symptoms due to specific types of encephalitis. Encephalitis caused by brain encephalitis caused by certain infections or autoimmune processes can show up with characteristic symptoms. Sensation of deja vu, the feeling of that one is reliving something already experienced, is a common finding in early stages of herpes simplex virus encephalitis, a type of autoimmune encephalitis affecting NMDA receptors can start with a flu-like illness. It can then lead to behavioral changes and unusual movement patterns affecting the mouth and face. Cognitive decline and impaired function of the autonomic nerve system. Another type of autoimmune encephalitis, LGI1, is associated with seizures or other abnormal movement of the face or arm. The symptoms of encephalitis may resemble other problems or medical conditions. Always consult your healthcare provider for a diagnosis. Encephalitis symptoms. Acute encephalitis shows up with an onset of symptoms that get worse over the course of days to weeks. Infectious encephalitis often starts with flu-like symptoms or headache and evolves to altered mental status and problems with thinking, remembering, and reasoning. Autoimmune encephalitis typically progresses over the course of weeks. Symptoms of encephalitis vary according to the area of the brain affected, and in autoimmune encephalitis, depending on the associated antibody. Physical symptoms: fever, seizures, headache, movement disorders, sensitivity to light, sensitivity to sound, neck stiffness, loss of consciousness. In severe cases, encephalitis symptoms may include weakness or partial paralysis in the arms and legs, double vision, impairment of speech or hearing, coma. I have none of them. Cognitive symptoms: excessive sleepiness, yes. Confusion and disorientation, a bit. Irritability, yes. Especially when someone just shoots out the bullshit, especially like the Bible bullshit by the Jehovah's Witness or other in-walk pastors and faithfuls. Anxiety, I used to have anxiety. Psychosis, no. Hallucinations, nope. Memory loss, yes. Other behavioral changes. Cognitive impairment, a bit. Symptoms due to specific types of encephalitis. Encephalitis caused by certain infections or autoimmune processes can show up with characteristic symptoms. A sensation of deja vu, the feeling that one is reliving something already experienced, is a common finding in early stages of a herpes simplex virus encephalitis. A type of autoimmune encephalitis affecting NMDA receptors can start with a flu-like illness. It can then lead to behavioral changes and unusual movement patterns affecting the mouth and face. Cognitive decline and impaired function of the autonomic nervous system. Another type of autoimmune encephalitis, LGI1, is associated with seizures or other abnormal movement of the face or arm. The symptoms of encephalitis may resemble other problems or medical conditions. Always consult your healthcare provider for a diagnosis. Yeah, I don't have deep trust in Western medicine doctors. Encephalitis diagnosis. You may need to be evaluated for encephalitis if you are experiencing a combination of symptoms such as fever, altered state of awareness, seizures, or changes in behavior or movement. It is very important to identify encephalitis promptly to decrease the risk of death or lasting complications, right? Yeah, I feel thirsty. To diagnose encephalitis, your healthcare provider might order tests, perform a medical exam, and discuss your medical history. The doctor may ask other respiratory illnesses or gastrointestinal illness. I think I have a gastrointestinal illness because my stool is very liquid. It has been that way for the last 5 years, especially got worse this year and last year. Very fluidity. It's more like diarrhea, except that I don't have sudden urge to go to the toilet except right after I wake up. Other than that, I have chronic urge to go and excrement in the toilet, take a shit. But it's not like diarrhea. Diarrhea, you have very hard time in controlling the urge to take a shit, right? So I wonder why I have liquid stool, except that I took in Korean herbal medicine juice to address supposedly my kidney problem, according to the diagnosis by the quack Chinese doctor. Probably the herbal medicine, sometimes they are strong and they affect your gastrointestinal metastasis or metabolism. So that's why you get diarrhea look like liquid stool. He or she will want to know if you have recently had a tick bite. No. Have been around pests? No. Or other animals? Yeah, like petting dogs. Or have traveled to certain locations? Yeah, I traveled to China. Recently, I traveled to China 6 months ago. Before that, like almost 10 months ago, I traveled to Japan, Osaka, Japan. And then there was a corona pandemic hiatus of 3 years. Before that, I traveled to China right after the coronavirus pandemic surfaced to the media. It was December 2019, right before our government declared the coronavirus pandemic, and all the systems turned into prevention and tracking down people with infections. Tests for encephalitis can include neuroimaging, such as brain MRI or CT scan, a lumbar puncture, spinal tap to check for signs of infection in the brain or spinal cord, electroencephalogram EEG to look for seizures or specific patterns of electrical activity in the brain. Yeah, I like that idea. I should remember that. Electroencephalogram EEG, blood tests or urine and stool tests to identify organisms or antibodies responsible for an infection. I like that. I have my annual physical checkup lined up for tests this Friday. So I need to submit my stool sample. Yeah, I'm going to take a shit in the mountain hill in the middle of the evening and take a sample of my stool and dump it into the small capsule, that plastic capsule that the hospital provided to be filled in. In rare cases, a biopsy of affected brain tissue may be performed to allow for examination under a microscope. Intracranial pressure monitoring (ICP) measures the pressure inside the skull to monitor the brain swelling. Encephalitis treatment. The key to surviving encephalitis is early detection and effective treatment of the underlying cause. A team of specialists working together is an important factor in optimal care. Encephalitis patients might require a stay in the ICU so that healthcare providers can watch for seizures, brain swelling, respiratory failure, or heart rhythm changes. Why there could be a heart rhythm changes, man? I don't know why. Why you suddenly come up with this heart problem thing, man? Encephalitis treatment depends on the underlying cause and symptoms and may include antiviral medications to fight viral infections affecting the brain, antibiotics to address underlying bacterial infections causing encephalitis, immunotherapy such as steroids, intravenous antibodies, IVIG, intravenous antibodies, or plasma exchange, the liquid, right? The blood has a liquid, almost a transparent liquid called plasma. Of course, plasma has a different meaning with a fluorescent light or your TV. Plasma TV here is different, right? It's ions and protons. They separate by the sudden strong voltage or spark or energy. They get ionized and separate, and they just turn into like a liquid mode plasma. Medications or other therapies to control seizures, a breathing tube or urinary catheter or feeding tube may be necessary if the person's encephalitis has caused loss of consciousness. Patients with encephalitis who have seizures that don't respond well to anti-seizure medications could benefit from a ketogenic diet, which is high in fat and low in carbohydrates. It has been effective in reducing seizures in drug-resistant epilepsy in children and adults. Seizures and epilepsy, they are quite similar to me, right? Epilepsy, 간질병 in Korean. Yes, I'm Korean. I work for Korea Telecom KT, the number one carrier in Korea. If you do have any questions about our telecom and IT services such as AI, text messaging, unified communications, table ordering system, TVs, yeah, we have a TV platform called Genie TV, like a Fios TV, Netflix, yes, everything. As well as patients with autoimmune encephalitis such as NMDA receptor encephalitis. The Johns Hopkins, this is advertisement, I think. The Johns Hopkins Encephalitis Center. The Johns Hopkins Encephalitis Center is dedicated to providing expert clinical care for patients with encephalitis. We have established a multidisciplinary group of specialists who work together to improve the diagnosis and treatment of patients with this dangerous and disabling condition. Thanks for your wonderful job. You are doing a superb job, and I have many Bibles. Encephalitis prognosis. Encephalitis is very serious. Both the acute stage and aftermath can be overwhelming for patients and their families. During the encephalitis attack, the inflamed brain tissue can suffer damage, which varies greatly between patients. In general, I think among patients is more correct because usually between is for two things. In general, the brain doesn't bounce back as quickly as other body parts, such as bone, skin, and muscles, but it does have some capacity to recover. Mild cases encephalitis are usually short and result in a full recovery. However, despite improvements in diagnosis and treatment, encephalitis still leads to death in about 10% of patients. Survivors of severe cases of encephalitis can be left with permanent problems such as fatigue, irritability, impaired concentration, seizures, hearing loss, memory loss, and blindness. The recovery process may take months to even years. Intensive rehabilitation involving specialists in neurology, occupational therapy, speech and language therapy, nutrition, and neuropsychology can help patients make the best possible recovery. Instead of neuropsychological sessions, I recommend the self awareness program called the Avatar course or Vipassana meditation. Or if you come to Korea, I can guide you through the meditation by taking you to the nearby nice temples where you can practice awareness with the monks or alone in the hall of the temple. Yes, it's free, but you have to pay for your food and stay, man. Nothing is free. And also, I have to make money off that program. Or I have to make money off you because I guide you, because I'm a licensed tour guide for foreigners in Korea. Can encephalitis be prevented? These measures can help prevent certain types of infectious encephalitis. Keep your vaccinations up to date, especially when traveling to areas known to have encephalitis causing viruses. Use proper hygiene and hand washing to help prevent the spread of viruses and bacteria. Avoid mosquito and tick exposure. If you are exposed to someone with bacterial encephalitis, contact your doctor. You may be offered a course of antibiotics to prevent you from getting the disease. Request an appointment. Find a doctor. 410-955-5000 Maryland, 855-695-4872. Outside of Maryland, 1-410-502-7683 international. Find a treatment center related. So this article is long and there were no new words that I don't remember or I don't recall or I don't know. So this article is very succinct, very easy to read, but it took me several minutes, because I had to stop in the middle of the reading because my work starts at 8:30 each morning. I come to work like by 8 usually, and I go to the fourth floor of my company. My office is on the first floor. Our building is 14-story high, is kind of a landmark in the city, in the eastern part of Gwangju. So I couldn't find any empty space to practice reading English because we have to pay for the space. So usually I go to the company cafeteria area, the hall where there is none, so that I could hold the entrance or porch, foyer, right? Or the hanging ground to the cafeteria, and I can just practice English by reading it aloud there. So that's how I practice English. Today, the second part of this reading, I am just sitting on my sofa at home. So this article was done reading in 2 sittings.